Hi everyone. My name is Yazan. I'm a third year at Rutgers, New Jersey Medical School, and I'm an incoming GI fellow at UCLA. We'll spend this hour talking about match strategies, or the overall roadmap, and trying to orient you on how to plan ahead. It's all about timing. It's all about thinking ahead, and not waiting for things to happen, but just planning what to do in each month, what to do, what's the next steps, when to do this, when to do that. So, without any further ado, let's get started. So this is my agenda for the day. We'll have seven or so of main talking points. I'll talk about for about 5 to 7 minutes about each one of them, and then we'll have around 20 minutes at the end for questions. I want to start by just letting you guys know or asking you to know your timeline. So the audience, is composed of medical students, graduates, or people actively applying. So just as a brief overview, the match starts in September, right? But right now in June, you can actually buy, and you should buy your token. Which is basically a profile that you or a number that you need to create or to put in your ERAS profile. It's something that you buy online through the ERAS website. You buy it now. You sign up for the match basically, and then you start preparing your application between on the website of the ERAS itself between now and September. In September, I think you can start submitting your applications around September 4th, but programs don't have access to the applications until September 24th. So it doesn't matter if you submit on September 4th or September 22nd, your application will go through and programs will see it. So it doesn't matter if you submit earlier, that programs will see your application earlier. It doesn't work like that. Having said that, don't wait until last minute, have some time. Sometimes some technical issues happen, so I would advise you to submit at least 3 days before the deadline. I think it's September 24th. Everything is online. You can double check the actual dates, and then starting after that up until early February, you start doing your interviews. You start getting emails, doing the interviews, etc. And then I think by the end of February or so, well, that's when you submit your rank list. March 15th was the match day, or is usually the match day. Sometimes they change it by a few days, and then basically the match season ends by that time. So let's get started by talking about the different things I want to talk about. First of all, the USMLE Step exams. I think, guys, the most important thing, or one of the most important things, is the Step score exams or the Step exams. Overall, three steps. Just briefly: Step 1, Step 2, and Step 3. Step 1 is now pass and fail, so more emphasis is being placed on Step 2. Obviously, historically, Step 1 used to be the biggest exam where what program would screen people based on, but nowadays more programs are leaning towards Step 2. Do programs have cutoffs for those exams? You can go over their website and check. Most programs would say on the website that they don't. I would say, but in reality, I think many programs actually screen applicants based on Step 2, the Step 2 score basically. So it's very important to score high. It will not guarantee you an interview, but it will at least not screen you out from the initial screening process, because it's one of the basic prelim ways to screen and filter applicants. They get thousands and thousands of applicants every program, and they want to have an objective way to screen applicants using it. It doesn't mean that if you score high that you are a better doctor necessarily or not. Having said that, there is some data showing correlation with higher rates of passing boards. It will show that you're someone who's persistent, who's willing to put the work, the effort, the hours to study more and score high. So those are like points that usually programs like. So Step 2, you need to score as high as you can. I'm not going to say numbers, but you need to score more than 245 overall to to be at least not screened out from most programs. The higher the better. If you can score to 65 to 70, of course go for that. Not all of us are great test takers, so having a score between 245 until 255, I think is a good number overall. But the higher obviously the better, and it would show a lot of those characteristics that I mentioned. Let's say, and then the third thing is Step 3. Step three is a double-edged sword. It's a great way for people to further strengthen their application. So let's say that you had a step two score of a little bit on the lower side or less than average. Step three would be a great option for you to make it up and basically overcome that score and show programs that, oh hey, I scored low. Having said that, I tried to overcome that. I worked hard and I scored really high in step three. At the same time, if you're not ready to take step three, don't take it and score low, because if you scored also low in step three, it's gonna backfire on you. If you scored high in step two and then you scored low in step three, it might backfire on you. So step three is not something necessary for you to take before you apply, but it's something to consider if you have a low step two score, or if you have time. I would encourage you to take step three and get also a high score. At the same time, I just want to say many programs and fellowships after residency also look at step scores. Maybe it's not as important as in residency, but still it's something that programs also look at. So it's something that will not change. It will follow you through your whole journey. So you want to make sure to spend enough time on that. Get all your resources, get tutoring if needed, spend enough time. Every person has a different way to study. They need different times to prepare for the exam. So it's okay if you take weeks or months or even years. It really doesn't matter. It's up to you. It's a very individualized process and experience. Ideally, you want to take them as soon as you can. You wanna not space out the exams between each other. I would advise you to take the exams after each other, because they overlap. They are related to each other with knowledge and such. So that would be helpful. So that's briefly about the USMLE Step exams. Talking about the next most important thing, in my opinion, which is the US clinical experience. So overall, having doing experience in the US or clinical experience in the US has different options. You have different options. There is electives that you do before graduation. There is observerships and externships that you can typically do after graduation from med school. I think the most meaningful one is doing an elective before graduation, because it's typically a hands-on experience. You're still a medical student. You work with other students, with that. So it's very meaningful, and it's basically it's going to be part of your curriculum when you apply to the ERA. You can mention that you did a rotation at this university hospital for 4 weeks in your last year of med school before graduation. I think that's one thing. Another way to specify the clinical experiences is inpatient versus outpatient. Inpatient meaning in the hospital itself, whether on floors or in the ICU. Outpatient meaning it's outside, like at a clinic or such. And the last way to specify those experiences is being at an academic program or an academic center, being at a community or affiliated center, and then being at a private practice center. We all want you guys to aim, or we all want to aim to do an elective at a academic program before graduation, ideally inpatient. I think that would have the most value, but not all of us are capable of doing such things in the US before graduation due to, whether visa issues or financial struggles. So I would say, it's okay. I myself were not able to do any electives before graduation, and that's totally fine. So the next thing I would say is to do something hands-on after graduation, like an externship. It has more value than an observership. An externship is something you do after graduation. You can do it at a private practice clinic. You can do it at a university hospital, at a community hospital. Again, you want to aim for something at at an academic center. And the reason I'm saying this, because when you do something at an academic center, you will work with residents, you will work with medical students, you will work with interns, you will work with physicians or slash attendings who are part of a program, part of a residency program, who are involved in selection criteria for incoming residents who have experience in medical education. So they will be able to evaluate you in a way that they evaluate other residents, other students. So when you work with them, when you work in this environment, you'll end up getting letters from those people, hopefully, and those letters will comment on your skills in the US healthcare medical system with other residents, other interns, even social workers, nurses, technicians, case managers. All of this really matters because that's what you will be doing, in your day to day during residency. Most residencies in the US, especially IM, there is a mix of inpatient and outpatient, but most programs do more inpatient. So I think it has a lot of value, and you will have also the experience or the opportunity to work with different physicians. So let's say you did a 4-week externship at this academic center. There were several attendings during those 4 weeks. Like let's say one attending for each 2 weeks at a time. So you'll have the opportunity to work with different people, to ask letters from different people, etc. So that's more opportunities, more options. Let's say you couldn't do an externship at an academic center, just try doing something at a community center or a community hospital, or even at a private practice. Even the many private practice attendings, you'll be surprised, they are affiliated with certain universities. So meaning that sometimes they have students/residents who comes through and rotates through their private practice like every few months or so. So they have an affiliation as an assistant or associate professor at a certain university. And so they would also be able to comment on that, on your experience compared to other trainees when they see you. If you couldn't do anything like as an externship, you do an observership. And an observership doesn't only means like shadowing, where you just shadow, don't do anything, and you just, walk behind the attending all day long. You can make the best out of it. You can be proactive. You can be as much helpful as you can in the clinic. You can prepare slides to present about something that you saw in the clinic. Like you had the attendings tells you about this patient, or you saw this patient, let's say, who had certain side effects from a medication for diabetes. You prepare that for the next day. You come and present. You review the literature about that. You discuss with the attendings. You suggest differential diagnosis, different assessment and plans. All of that really translates to your letter and it will improve your experience. So it doesn't mean shadowing that you just be there and don't do anything. You can make the best out of it. From a personal experience, I wasn't able to do any electives. As I said, I did a total of 10 months of observerships before I applied for residency. I did, and they were mostly at private practice clinics that were affiliated with academic centers. At the same time, I also did an externship for a month, which was hands-on. Seeing it was also in an outpatient setting. Unfortunately, it was during the COVID era, so I couldn't do anything inpatient. But still, it was an amazing experience. You will make the best out of it. You will see a lot of patients. You will work with different attendings for different weeks, so you will get different letters from different people, and all of that will translate into strengthening your CV. Last thing about the clinical experiences in the US is that you want to plan really ahead in time. Most of those externships, electives, they run out really early, like even a year or so before. So think about it that if you're applying, let's say next cycle, like in a year from now, you want to start looking for opportunities now or the next 3-4 months, because those especially big programs, they want, step exams, they want a TOEFL or an IELTS. If you are outside of the US, they want a lot of credentials, like something from your med school, some insurances, other stuff. So it's a process, it's a lengthy process, but it's doable. And once you get it, it's going to change your application. It's really meaningful. I can't, stress on that enough. Are there places or are there websites to help us, gain those experiences? Of course, there is a lot of stuff online. The Maths Guy also offers, a lot of resources. Honestly, just go to the website, see how can we help you get those clinical experiences, in the US, whether before graduation or after graduation. So invest in that. It's important. Letters of recommendation is the next thing. I think that's also very important. So for letters, I kind of spoke a little bit about that during the clinical experiences section, but when you submit letters, you can submit up to 4 letters to each program. Some programs ask for 3 letters, some programs ask for 4. So you really have to go to their website and see what they're asking for if you want to, but you can submit up to 4 to each program. I don't think you can submit more than 4, and none ask for, to my knowledge, ask for more than 4 letters. So I ended up submitting 4 letters to each program I applied. The issue or the thing with the letters, guys, is that you can ask as much as you want. You can ask 10 different attendings for 10 different letters, right? And they will be uploaded on your ERAS, and then you can assign which letter to which program. And you need to be smart about that. You need to go to the program website to see, do they have specific criteria for the letters? Do they want a letter from an internal medicine physician, or are they okay by just any other letter from any medicine subspecialty physician. Let's say you worked with I think getting experiences with any subspecialty in internal medicine is great, but doing it in internal medicine itself, whether inpatient with a hospitalist or with a PCP as an outpatient, is has a lot of value. If you couldn't do that, I mean, you work with a gastroenterologist, a cardiologist, an endocrinologist, an ID doc, a pulmocrat, because all of those attendings trained in IM before applying to their subspecialty. And so the same goes about other like surgical specialties, I believe. But I'll speak more about IM since I did IM. For letters, the way I did look at my letters, you look at the program. If it's a big university program that really emphasizes on research on their website, I think if you have a research letter, I think you should submit at least one research letter to those programs, and then 3 clinical letters. I think for IMGs, clinical letters have more value because you want, you're coming from a different system, different environment. You want people to feel confident about you seeing patients, doing clinical work on day to day. So clinical letters have, I think, a great value. But if you have a research letter and you're applying to a big university program, I would encourage you to submit 3 clinical letters, 1 research letter to that program. Let's say if you're applying to a community program that's affiliated with a university, they don't have like the big emphasis on research. They don't have labs and all of this basic science research in their resources. But every program likes a researcher. Everyone does research, at least QA, QI, or basic retrospective studies. So it's totally okay to submit 1 research letter and 3 clinical letters to those programs as well. Your research letter will not only say that, oh, you're a good researcher. No, it will also comment on your teamwork skills. It will comment on you blending in the research team, working with different trainees, etc. So it can have a lot of value, more than just talking about, oh, this guy or knows how to do analysis or etc. Right? So that's what I would say. And when you also think about your clinical letters, as I said, you have externship letters, you have observership letters, you have elective letters. You want to aim for the letter that has more hands-on. I think it has more value. You want to aim for the letter overall that has more personal stuff about you. You want to ask people for a strong letter of recommendation when you ask, not only a letter. And you want to know if they will spend the time and effort to sit down and write you a strong letter. Because the last thing you want to do is to submit a generic letter to a program, that doesn't talk about any specific experiences or specific scenarios that you did during your rotation. You want it to be as specific as possible. That's another advice. And the third advice would be to ask for more senior people who have more experience, who have a bigger name at a bigger institute for those letters. It's a tricky part because you might the big question about letters of recommendation is that, oh, do I get a letter from a big name, but it will be generic? Or do I get a letter from not a very big name, but it may be an assistant professor who's a junior attending or just starting, but it's a very strong and personal letter. So it's really it's mixed opinions. In my opinion, I think you have to go with a good balance, but you have to go with a more personal, strong letter. I think it has way more value than getting a generic letter from just writing your name and then everything would be so generic. And I think from my experience in the US, people usually don't write much generic letters. If they agree to write you a letter, they will spend the time to write you a letter, and you wanna ask again for a strong one when you ask for it. So ask as much as you can. Get your options. Have the letter. This is very important. Have the letters to be waived. Don't see your letters. Don't have when you assign someone in your ERAS profile to upload your letter. You put their email and then you choose it to be waived, so you don't have access to the letter. Because really, like, you think about it, anyone cares about a letter that you are reading, and then you'll basically know if it's a good one or not a good one, and you won't submit it if it's not a good one, right? So have it to be waived, and they will upload it, and then you will decide based on the program which letter to which program. The last thing about this before I move on to the next point is that some programs ask for letters from your medical school, from maybe the chair of medicine or the PD of IM at your medical school or so. So spend some time, go on the program's website, screen for what are they looking for, and then assign based on that. If they ask for that and you don't have a letter from your med school, it's fine. Submit letters from the US. I think the letters from this is a very important point as well. Letters from physicians who practice in the US, I think, have the biggest value, because not because they're better or anything. No, nothing like that. Just, it doesn't necessarily mean that, but it's because they want a letter from someone who is in the system, who knows the system, who can evaluate you as a person coming to practice in the system, right? So you want to submit your letters from people who practice here, unless the program specifically asks for a letter from your medical school chair or PD, etc. So those are my points for the letters. And the last thing I want to say, that your dean's letter, I think it's called the MSPE, if I'm not mistaken. It's a different letter from those letters. So that's something that you should submit to every program, and it's automatically submitted once you upload it. So it's not in the same it doesn't count as one of the 4 letters you're submitting to the programs. Okay, moving to research. So research nowadays, step 1 is pass and fail. More people are focusing more on step 2, getting higher scores, more resources are available, more tutoring is available, everyone is scoring higher and higher. So research is right now one of the things that's essential, I think, in your application. It's for all of those reasons, and also because more people have access to research. You can do research from anywhere in the world right now. You can do stuff from home, you can do stuff with your colleagues or classmates from medical schools, or people in the US or outside of the US. So it's really available, and everyone is doing it. So you should be doing research to strengthen your application, but also you wanna show in your application that you care about medicine, you care about advancing the science, and you want to be sincere about it, right? You just don't want to say fancy words and not really care about any of that. It will show, people can tell, but you actually want to, research is a big component of your residency as well. You'll be reading articles, you'll be following guidelines, you'll be seeing recent systematic reviews and meta-analysis about certain ways to manage patients. You want to be able to critique the literature. You want to be able to formulate a lot of ideas based on what you're reading. So it's very essential. I think doing research in the US has the biggest value for many reasons. First of all, it's a great start to get you a visa to come to the US if you are outside of the country. I think that's great. Another thing is that when you are in the US doing research, usually it's going to be at an academic institution, right? You will be working with teams of residents, fellows, attendings, nurses, technicians, research coordinators, research associates, research assistants, research fellows, all of those. And you will be collaborating with other departments and other institutions. So it will basically give you an experience to work in a sophisticated healthcare system in the US. It will show that you're someone who came from a different system as an IMG, let's say, and then you were able to adapt and to work with all of those different people and to excel in it. So it's really important. And then that will also be reflected on your letter. If you're working with a mentor for a year, let's say, before you apply in research, or you've been working with them for 6 to 8 months, you did a lot of projects, you were a great team player, they will comment on all of that in their letter. As I said in the letters part, it's not going to be, oh, this person knows how to do stats or knows how to write or has great research hypothesis ideas. No, it will say that, hopefully, but it will also comment on your personal attributes that you can bring to the table. You're someone who's pleasant to work with, good team player, always offering to help, etc. All of those stuff are really important for residency. So this is one of the things about, one of the few strengths of opt research. Another thing is that when you start a position, you can be, there are different positions. There is like an associate, a research associate, research assistant, research fellow, research coordinator, research trainee, paid, unpaid. I think it really doesn't matter what's the title that you have. It really matters what you do with the title or what you do with your position. You can be a research fellow who's getting paid 60 or 70K a year, and then end up the year being unproductive, not publishing, not being a great team player, not getting a strong letter. It will not, like, having the title and not having anything else will not give you anything in your ERAS application. While you can be a research trainee who's here not getting paid initially, and then you're submitting abstracts to conferences, you're submitting manuscripts on, to PubMed indexed journals, you're working in different teams, you're leading projects, you're co-leading projects, you're helping residents, you're helping fellows, you're working with different attendings, you're collaborating with different departments at different institutions in multi-center studies. All of this will translate into a stronger ERAS application. You will talk about that in your application. Furthermore, this will be mentioned in your letter, hopefully. So that's another thing. When you go to those conferences, one more thing about research, you connect with people from different programs. Let's say you're doing research in GI or cardio. You go to those conferences, you're going to be meeting internal medicine residents who are applying to cardio or GI from different institutions. You will connect, you will network, you will ask for their advice, they will know you. It will open more doors for you to explore whether to go and maybe do a rotation later on, or maybe for them to review your CV or to give you some advice about their program or other programs. Literally it's a lot of possibilities that you don't know that they exist until you actually encounter them. Another last thing about research I want to say is that you want to be productive, you want to publish, you want to have focused questions, not only publish anything that's in any journal. You want to be a little bit more focused, a bit, in a certain area, whether if you're interested in GI or CARD or endocrine or ID, you want to start your research trajectory targeting one area. But it's okay if you don't have an interest. You can always change. Internal medicine is 3 years. You can do a different rotation and change your mind after. But it's also helpful if you're thinking ahead in applying to a certain fellowship. It will help you to have an early on. So once you start your residency, you'll tell your PD, hey, I'm applying to cardiology after my second year. That's my passion, and I've been doing research in cards for the last year or so, and I plan to continue doing this during residency. And everyone likes a person who brings research to their program because it will open more doors to other residents. It will give it's some experience, that some value that you bring to the program. So they like that. My experience is that I did 1 year of a postdoc research fellowship in GI before I applied for internal medicine, and then while I was applying, I kept my position. So let's say I submit my application in September. I was still working during the interview season on my research. So whenever you have an interview, oh, what are you doing right now? Oh, rather than saying I'm home outside of the US, just chilling or doing anything else. No, I'm actually in the US, spending or investing money, investing time, investing effort to work on my CV, work on myself, and I'm still actively doing research, actively trying to improve myself. So they will they will see this value. People notice all of this. So I think that's everything, or not everything, but that's, I think, the most important points about research. Let's talk about personal statement very briefly. Personal statements are important. Don't underestimate them. People read them. People will bring them up in nearly every interview. I remember during my residency interviews or fellowship interviews, people actually were asking questions about personal statements. They were commenting on them. Know your personal statement word by word. You want to get to the point that when you're having the interviews, you have the lines in your mind, one at a time. It's your story, so you have to know everything you're writing about, right? And then please be sincere and don't make up stories. And people can tell. They will ask more specific questions. Just be sincere about who you are, what's your journey like, what do you want to accomplish, what can you bring to the table, right? Start working early on. I started working on my personal statement literally 1 year before I submitted my application. I had tens of drafts. One advice I like to say is that one advice someone gave me years ago is that when you are doing rotations, if you have a story or an experience or an interaction with one of the patients, and then it really resonates in your mind, oh, this is why I want to do family medicine, internal medicine, surgery, etc. Just write it very briefly. It's somewhere on your phone or on your on your book. And then once you get to the point of writing your personal statement, you'll have a lot of stories, a lot of interactions, a lot of thoughts and ideas. And then you just start writing everything you have in mind, and then you compile it. You have a draft, you have a second draft, you have a third draft. You ask for feedback from it's very important from your mentor, whether it's a research mentor or a clinical mentor or an academic mentor. I think it's also very important from residents who applied to the math recently in the last 5 years or so, from someone who is a native English speaking person, whether they are linguistics, or if you have a cousin who has a degree in such thing in the US, or someone who was born here who's good with words. You want someone to give you like really good feedback about how to structure if anything doesn't make sense, and you want to be very humble about it and change it. You want someone to review your PS and actually destroy it and then have you rewrite a lot of it. You'll get a lot of feedback. You don't have to incorporate everything in people say. You can get a lot of different ideas, but you choose whatever works for you and you do it. But it's very essential to get this feedback. Other ERAS experiences. So other than what we talk about, there are some other experiences that you probably should try to accomplish or to get. Like let's say about teaching experiences. Everyone likes an educator. Residency is a it's a clinical job, but you're also teaching. You're teaching your patients, you're teaching or educating your co-residents, your interns. So you're doing lectures. So if you have a teaching experience, or if you have the time to do a teaching experience, you should invest in that. Whether it's tutoring, whether it's something at your med school with your juniors, whether it's something in the research you're doing, you learn, you're teaching others at your career institutions. Everything really matters. Don't underestimate any of those experiences. Let's say, other than that, I mean, again, everyone likes an educator. You're going to be asked, oh, you during the interviews and such, this will be brought up. Oh, if you're interested in medical education, you can ask what are some of the avenues to explore during residency. What lectures can I, would I get the opportunity to give? Morning reports, noon lectures, mix-up questions, which is like the board questions. All of this really matters, and people like programs like applicants who are invested in education. Again, you have to be sincere about it. If you are not someone who's invested in medical education, you please don't lie about that. Don't make things up, but be sincere. And I think it's something that has a big value. And other than education, I think one big thing is leadership experiences and volunteering experiences. You don't have to have 20 volunteering experiences when you submit your application. I think right nowadays you have 10 experiences to list in your areas, and I think 1 to 2 volunteering experience is enough. Maybe one even if you have other more meaningful things. It really depends on what other experiences you have, but I think it's important to have at least one volunteering experience, whether it's in the US or outside of the US. I think it should be meaningful. Ideally, something related to medicine, whether you volunteered at a clinic or, even here at a hospital during COVID after, or we went to help people at a hospice center, spending your time, or at a food pantry. I think everything has its own value. It's really what you learned from that experience, and what it taught you, and how it made you a better physician in the future, how it influenced your career. So that's something that's important. Leadership is something also I think you should think about. There is a lot of leadership experiences. They might overlap with your teaching experiences. If you were, let's say, a chief of resident at your in your residency before applying here to the US in your country, that's a leadership position, but it's also an educational position, right? If you were a committee leader in a QA/QI initiative at a certain point in your career, whether as a medical student or as a graduate, that's also something that you can bring to the table, and then have it in your areas. I think at least one leadership experience is important if you are someone who's interested in that avenue. It's not essential. Again, it really depends on what you have. I think I went over the most important things, like tried by order, like scores, clinical experiences, letters, research, etc. But other stuff really, gives more diversity to your application and strengthen your application. So think about anything you did in the past. Don't underestimate it, because you might think, oh, it doesn't have much value, but it actually does. You'll be surprised about what people talk about in their application. So, take that into account. We're like at the 20-minute mark. I think the last thing I want to talk about, some last miscellaneous things that you guys should consider, especially with the current era system, because they can be tricky. signaling programs, geographical preferences, application strategies. Unfortunately, 1 hour is not enough to talk about any of those, but just briefly, some tips, some overview about them. Signaling is also like a relatively newer thing in the last 5 years, I think, or 4 years that started, or 4 years, I guess this is the fourth year. You want to be clever about, be smart about who to signal. Try to not to waste your signal on programs that will not even review your application because of your year of graduation or step scores or etc. Or you want to go to the program's website, see their current residents, see if they match your profile, and then based on that decide to signal or not. There's gold signaling and there's silver signaling. I think it's okay to have an overreach program maybe, but don't waste more than one signal on that, and then the other signals can be tailored toward programs that you have actually a good chance in matching in. It's getting very competitive, so think about that carefully. And the last thing would be where to apply, which programs to apply to. It's within the same avenue where you have to go to the program's website. I literally went on the program's website one at a time, looked at their residents, looked at their, I was interested in, GI. So I would go and see their fellowship match, where do people practice after, what opportunities do they have during residency, whether research or medical education or other community outreach programs they have. And based on that, I decided to submit or to apply to those programs, and be generous about applying. I would say it's always safer to apply more than to apply less. I think since it's virtual, it's costly, I know, but I think it's an investment that you will do probably, hopefully, once in your life, and on the long run, it will not change anything if you apply, like, let's say, to a 20 more program that what you were thinking about before. So yeah, thank you all for your time. I hope this was helpful. Thank you, Ellie, for helping in co-hosting this. I'll leave it up to you if you want to mention some last words. And good luck to everyone. Pleasure to be here.
Thank you, Dr. Aboud, for this valuable session. I hope everyone has benefited from this valuable information. I just want to highlight something, that Dr. Aboud is one of our best advisors here at the Match Guy company, and we can help you guys if you need any help or if you have any question. You can just text us. I already commented the number of the company. You can text me there over WhatsApp. We can jump on a call, see how we can help and work together to build up a good strategy for you to match into residency, starting from residency advising, as Dr. Aboud is one of our best advisors, and we have a lot of other advisors. Also, we can help you to build a very good and optimized personal statement and DRS application, as long with the interview preparations. I'll leave it up to you guys. You can see my number here. You can reach out to us over WhatsApp. And thank you so much again for this valuable information, Dr. Aboud. And see you guys next week. Have a good day, everyone.